A follow-up to that, though, is some of the protective measures that are, well, for lack of a better word, people are hoarding, such as face masks and gloves and other materials. Do you recommend using those materials, Dr. Chung, in terms of wearing a face mask? Is there certain places where that practice should be in play? Does it matter what kind of face mask that you would use, or what type of glove? If there's anything that we could do in addition to not just the hand washing and wiping down.
Right, and I would reiterate what Dr. McGarry said about this. It's really good basic hand hygiene that's really going to affect the transmission and protecting yourself. Certainly, there are, you know, as we said earlier, talked about earlier about the mode of transmission. It's typically from aerosol and from inanimate objects. So those are things that you need to think about. However, I need to take a step back. Wearing a face mask really has very limited value in protecting the wearer, okay? So the important thing to think about is, are there ways to minimize the debris field when you sneeze and cough, or when you know, the microsprays when you talk? And that's why, you know, maybe a face mask is good in those situations to protect each other. However, other barriers, especially given the current limitations or limits in the resources, I think things like homemade face masks and bandanas are going to help you to reduce the debris field. And recall the other part of this, so that's the mechanism for barrier and protection. The other part is that we talked about, you know, there are a lot of potential asymptomatic people out there, cases out there that may be infectious, or the cases that are at pre-symptomatic stage, which are also infectious. And again, according to what Dr. Fauci is saying, maybe 25 to 50% of those cases are asymptomatic. So the prevalence of cases out there may be a lot higher, and is a lot higher than what we know, because of lack of, you know, the availability of the test kits for us to get a sense of the prevalence out there. So at the end of the day, I think wearing some type of facial barrier to kind of somewhat self-quarantine is a good public health measure. And so I think, you know, without exhausting or cannibalizing supplies that the hospitals may need, I think those are good options.
Thank you. Dr. McGarry, any additions to that preventive measure?
Yeah, just one quick thing. We know that certainly wearing any kind of face covering at this point is probably a good idea from transmitting and containing sneezes and coughs. The other odd thing is it, I believe, also helps folks remember to not touch their face. And so, again, if we're washing our hands consistently, we're good, but it also will help folks from stopping touching their eyes, nose, and mouth, which are pretty vulnerable as well. So double help it can give us.
Great, thank you. I appreciate that information. It gives a little bit more insight as to why we need to do some of these preventive measures and the purpose behind it. I think there's a great deal of confusion on the face mask issue and why should I or shouldn't I be wearing it. So thank you for that.